SUNY at Buffalo medical student Jose Baez is learning from the best at urban family practice. And besides a stellar education in primary care medicine, Baez is learning a lot about Gbuahn, directly from the real experts, Gbuahn members themselves.
Initially, I thought that Gbuahn was like a G van, so I thought it was a transportation kind of service, but talking to the patients, I started realizing that they do more than that.
In making his rounds at urban family practice, Baez heard his patients mention more than once what they like most about Gbuahn. Baez says the Gbuahn transportation service is always cited near the top.
A lot of patients don't have the ability to get from place to place, don't have the ability to make it to their appointments because they don't have a car, or they might have a family member who has a car, but that person is working, or they have their own responsibilities. So having someone pick them up from home, take them to the clinic, or take them to their appointments has been a big thing and very helpful for them.
In addition to transportation, Baez says the Gbuahn members he talks to are grateful for the assistance they receive in navigating the healthcare system.
It's just someone, being there, letting them know you have an appointment on certain days. A lot of these patients are elderly patients, and they forget that they have appointments, and they forget that they need to go to a cardiologist on Monday, then they need to go to the clinic on Tuesday, and then the week after that they have to get, a certain x-ray done. So having someone, they like having someone kind of being on top of them, being like, hey, remember that on Tuesday at 9 a.m. we have to do this. A lot of them they live by themselves. They don't have families, they don't have, kids, wives, husbands, people that can go with them to these appointments. So having someone that they feel, although they're not, family, or someone they can, know for a long time, kind of go with them, is kind of helpful, just having that company.
While Baez was an undergraduate student at the City College of New York, he volunteered for an organization called Health Leads. Health Leads is similar to Gbuahn in that both organizations address the importance of the connection between poverty and poor health. Gbuahn and Health Leads both connect low-income patients with basic resources such as food, housing, and heating assistance that they need to stay healthy. Baez says the big difference between the two organizations is that while Health Leads does offer referrals, Gbuahn goes a step further.
They offer these services and they physically, take the people to these services and provide them versus just referring them to the service. Like you refer them to a car service that takes them to the clinic. They actually, drive them to the clinic versus just sending them to someone else who would do that for them.
Baez remembers one patient in particular. This man was from Puerto Rico, living in Buffalo with multiple health conditions, but no family to support him. This gentleman did not speak English and did not have easy access to transportation. A construction accident had also left him disabled, and he had untreated diabetes.
He wasn't able to go to the clinic or to his appointments because, one, he didn't know any English. He was disabled, he didn't have a car, he didn't have anyone to kind of tell him, hey dad, or hey honey, you have an appointment on Tuesday, don't forget. And so he was telling me that having Gbuahn is kind of like a blessing. He has someone who does those things, acting as his wife or his children or his friend who is on top of his health care and helping him get to the services that he needs to go to and keep him healthy.
For G News, this is Julie Dorr reporting.